Welcome back to another edition of Obesity Week Broadcast News. I'm John Holt.
And I'm Sharon Snowden. We have lots of good information for you as you plan your final days here.
There are still many activities ahead and exciting sessions to attend, including 2 journal-supported sessions.
That's right. First, the editors of Obesity are holding the first annual Obesity Symposium, which will include the presentation of 6 winning manuscripts by the authors.
These state-of-the-art papers cover topics ranging from the control of energy balance to innovative clinical translational studies that challenge current paradigms to novel proof-of-concept studies.
The authors of the winning papers will present their research during the symposium, and the papers will be published in a special section of the November issue of Obesity.
The editor of the Journal of the American Medical Association, Dr. Edward Livingston, will host a special 60-minute symposium of obesity-related papers selected from the abstracts submitted to the Obesity Society.
The papers presented will focus on the basic and clinical science aspects of obesity treatment, identification of novel risk factors for the development of obesity, and obesity policy. The
authors of the selected abstracts were invited to submit a paper to JAMA for an expedited review and publishing in JAMA in November 2013.
The ASMBS TOS SBCBM Symposium on the Management of Metabolic Syndrome is set for Friday afternoon.
Topics for this symposium range from the latest advances in the medical treatment of metabolic syndrome, weight loss as a cure for metabolic syndrome, metabolic surgery, and innovative procedures for treating metabolic syndrome.
A panel discussion as well as a question and answer session will follow the formal presentations.
Saturday morning, the ASMBS and TOS present a symposium on the management of adolescent obesity.
This symposium will include a discussion of bariatric surgery for adolescents, risky behavior, early results of teen lab, the role of doctors in adolescent obesity, and the role of bariatric surgery in younger children.
Plan to visit the exhibit hall while you're here this week. The exhibits are open until 3:30 Thursday and Friday.
More than 150 companies will showcase the newest and most innovative products and services available to healthcare professionals.
Time running out to view those posters, too. They're available only until 3:30 on Friday afternoon.
The lunch break provides the perfect time to visit the posters. Many of the investigators will be at their posters and eager to talk about their work.
Still ahead on Obesity Week Broadcast News.
More information about sessions important for you at this year's meeting.
Ethicon is a proud platinum sponsor of Obesity Week 2013. featuring a full bariatric portfolio to support you and your patients. We look forward to seeing you in the exhibit hall.
Dr. Edward Mason is recognized as the father of modern bariatric surgery. He performed the first gastric bypass for morbid obesity in 1966. Dr. Mason is the founding president of the society. Each year, he's honored through a lecture named for him. This year, Dr. Bruce Wolfe delivers that talk. His topic, bariatric surgery and the NIH. Following Dr. Wolfe's talk, ASMBS President Dr. Jamie Ponce delivers his presidential address. He's chosen as his topic, 30 years of accomplishments. Where do we go from here? Access to care issues are always a concern for bariatric surgeons. We spoke with Dr. Wayne English, the chair of the Access to Care Committee, about the progress being made toward assuring coverage, especially for Medicare patients.
There's been major improvements in sleeve gastrectomy coverage for Medicare patients. Just 2 years ago, there were no states across the country that had sleeve gastrectomy coverage. And through the tireless efforts of many, we now have coverage in all 50 states.
We also asked about coverage with the implementation of the Affordable Care Act.
So under the current design of the health insurance exchanges, there are only 5 states that cover both bariatric surgery and medical weight loss. There are 13 states that cover bariatric surgery only, and 28 states that do not cover bariatric surgery at all. If you are fortunate enough to live in a state that covers bariatric surgery, you can expect to see an increase in the number of covered lives that are affected and will have access to bariatric surgery. If you live in a state that does not have coverage, then you will more than likely not see any difference in the activity than what you see currently.
Certainly, meetings like this help keep ASMBS members informed on important issues, but the information flow continues year-round. One of the most important tools for that is the position paper. We asked Dr. Stacy Breathauer, the chair of the Critical Issues Committee, about the value of these papers.
They help clarify issues. The position statements are evidence-based, comprehensive, systematic reviews of a particular topic, and they provide a lot of strong evidence for a particular topic, but also they provide one source for the surgeon to go to really get a comprehensive overview of the topic, as well as our society's position on that topic.
The ASMBS also encourages you to be active in your state and community. That's why there's an emphasis on the formation of state and local chapters. Here's Dr. Michael Nussbaum.
It's very important to meet with the members within your state. Not only are there issues that you need to know about which are going on within the state, sometimes there are access to care issues. We certainly recommend that not only the members of each state chapter, but the stars and the chapter presidents get involved with the Access to Care Committee so they're able to go to Washington, D.C. and promote the issues that exist within their state to their local representatives.
If you're interested in organizing a state chapter, all you need is 1 or 2 other surgeons within the state. Then contact Georgianne Mallory at the ASMBS office and you are well on your way to getting a state chapter. Still more news and information ahead on Obesity Week Broadcast News, but first, watch this.
the Obesity Society is committed to advancing policy changes that address the current epidemic of obesity. To do that, leadership opened the door to partnerships with a variety of groups who share the same goals. We welcome back Ted Kyle. He chairs the TOS Advocacy Committee.
In 2008, Council identified advocacy as a key issue to energize the field. And in 2009, we began building partnerships with a range of other stakeholders to build a larger constituency of folks advocating for a more evidence-based approach to obesity. We've collaborated with the Stop Obesity Alliance, with the Obesity Action Coalition, an organization that now represents 50,000 patients, with the Academy of Nutrition and Dietetics, with the ASMBS, and other organizations through the obesity care continuum. The result of that has been a lot of progress, where before research and treatment options for obesity were being viewed in a very harsh light. Now we're making more progress, and we have a much more favorable environment for investing in obesity.
New collaborations are not limited to other professional groups. To tackle the epidemic of obesity, the leadership determined it is time to work with industry. Dr. Martin Binks explains that decision.
TOS's fundraising policy is tightly linked to our mission to solve the obesity epidemic. And in looking at our policy, we realized that we had closed the door to collaboration with a number of different sectors and organizations that may be willing to help out in our efforts to combat obesity. By creating a new development policy, we've removed barriers so that we can create collaborations across various industries, whether it be the technology industries creating fitness devices and technology to support obesity, whether it be food companies who influence the food chain, and we can all get together and try to solve the issues that are presented with societal obesity.
So Mr. Kyle and Dr. Binks have given you a quick look at some of the TOS plans to help reverse the challenge of obesity. You are invited to get involved. There is value to stay involved even after the annual meeting. Dr. Nick Durander tells you how.
You may or may not be a TOS member, but if you're not a TOS member, by now I hope you have seen what TOS is all about and what great science TOS is promoting. So if you're excited, want to join TOS, please stop by our booth and we'll be happy to explain to you all the wonderful benefits of TOS membership.
Don't go away. There's still more ahead on today's Obesity Week broadcast news.
Ethicon is a proud platinum sponsor of Obesity Week 2013, featuring a full bariatric portfolio to support you and your patients. We look forward to seeing you in the exhibit hall.
The very successful After Dark Club, pioneered by the ASMBS, comes to Obesity Weekend. This is a party you won't want to miss.
This is an adults-only party open to all Obesity Week attendees where you can relax as you wrap up your stay here in Atlanta.
It's a night of cocktails, casinos, and dancing with a great place to socialize, meet old friends and new acquaintances.
It all takes place in the Marriott Atrium Ballroom. Check the registration area for tickets.
This meeting is still well underway, but would it surprise you to know we're already working on Obesity Week 2014?
It will be a great meeting in another great convention city, Boston.
Plan now to attend Obesity Week 2014, November 2nd to the 7th in Boston, Massachusetts.
All of us hope you've had a great time while here in Atlanta and that this historic meeting provided a great educational experience.
Thanks for making Obesity Week Broadcast News a meeting information source while you were here.
Have a great time if you're spending a few extra days here. We'll see you next year in Boston.